Okay, so the first one is the paediatric case. So this is just a run through, just a reminder of the structure we've been using. So I use this as kind of just a memory aid, BIDN. It just made sense because it's birth, immunization, development, and nutrition. Yeah, that helps me remember it. But by all means, if you think that's pointless, then ignore it. And then so we ask, birth. So ask about the pregnancy. How was the pregnancy? Any complications? So I like to split it into 3 questions really. Any problems during the pregnancy? The birth itself, was it a natural birth? I wouldn't say normal vaginal delivery, but a natural birth or cesarean section, any complications, and then any specific aftercare that you had afterwards, or was it kind of routine? And then on immunization, is his vaccinations or are vaccinations all up to date? And then, are you happy with his development? Just a simple question, and that should cover you for that. And then this one is kind of I would only really ask if an infant's about breastfeeding and bottle feeding and kind of details there. I wouldn't really if it's a 10-year-old. Unless it's directly relevant, yeah, I don't think it's worth wasting time on that. And then wee and poo, just asking about, the frequency of nappy changes, how often they get wet, how often they get dirty. Yeah, any changes in, the smell, in the urine or the stools or the appearance of them. And then this one, yeah, so with this one, I think I would only include this if it's directly relevant to the case. So if someone's presenting with something that's a bit suspicious for whatever reason, it may be that they've got bruises, right? But it may be a bit more innocuous. It may be that just there are signs of neglect perhaps, or just the story doesn't add up. So it might be worth asking a few questions. But obviously it's a very sensitive topic, so you need to be very careful about how you phrase things when you're screening for non-accidental injuries. A good starting point is always to ask about who's at home and just to get an idea of the support network available to the child. And yeah, she may give you some clues, or he or she may give you some clues about what's going on there. Yeah, and the rest is just the same. ICE is really important. So in the UK, I'm sure you've heard this by now, but in the UK, they really love ideas, concerns, and expectations. So that should always be on the forefront of your mind. There isn't a particular place where that needs to, where you need to ask about them. So don't think that you need to structure it like, have you got any ideas about what might be going on? Have you got any concerns? What are you expecting today? So number one, I would say try and avoid using the words themselves, ideas, concerns, and expectations. Perhaps you could use thoughts instead of ideas. Instead of concerns, you could use worries. Instead of expectations, you could say, was there anything particular you're hoping for today? Just because examiners, they don't particularly like it. This is just what I'm hearing from GPs and other NHS doctors, and they don't like it when you kind of rigidly go through them as a list to check off. They should be something that you should be screening for all the time, and you should be reacting to cues. So the patient might give you a cue right at the beginning, and they might give you a cue at the end. And so rather than thinking, no, my eyes, I'm going to address that later on, and just ignoring it, you need to show that you're going to address it there and then. So if she talks about her concerns from the beginning, then you need to explore her concerns at the beginning. So it's on the patient's terms for the most part. So they definitely don't ignore those cues. You will lose marks for that. Right. So should we get started with the first case? Okay. So let me know when you're ready, and we'll do this the first case.
Yeah, let's do it.
Right. Okay. So you're a foundation year 2 doctor in the GP surgery. Ben Stone is a 3-year-old child who's not been feeling well. The mother would like to get some advice about his condition. The mother has emailed some photos to you. Talk to the mother and address her concerns. So there are the photos.
Yeah.
Right, so it looks like quite a generalized rash, and particularly concentrated particularly in the back of the trunk. Yeah, and there's kind of a more zoomed in view, so you can see it's quite, it's a particular rash really. Yeah. So what are your thoughts looking at that rash, approaching this kind of station?
First of all, about explore the rash.
Yeah.
The focus history of the rash, and then explain about the condition and then the management.
But looking at the photos, what's your kind of initial impression looking at them?
Maybe chickenpox.
Right.
The measles are a bit different.
Yeah.
Very sad.
Yeah, definitely those kind of conditions. Yeah, measles, rubella, and chickenpox. Those would be the ones I'll be thinking of for sure.
Yeah. Measles are more concentrated in the face and the vesicular. This one looks like a vesicular rash, more on the back of the patient.
Right. Yeah. Right. Whenever you're ready.
Yeah, okay.
Hi there. Hi.
My name is Dr. Hashim, a 2 here in the GP. Can you please tell me your name?
Hi, my name's Amy Stone.
Okay, and the name of your child and the age?
So yeah, my little one, he's called Ben Stone, and he's 3 years old.
All right, good to see you. Can you please tell me what brings you here today?
He's been in nursery, and just a few hours ago, dropped him off at nursery, and then I got a phone call from some of the staff there, and they said that he's developed a bit of a rash. He doesn't look well. So yeah, so they sent him home, and so I thought come in today to see what's going on, really.
All right, I can understand. So can you tell me a bit more about it? Like, when did it start?
So I think the rash just we hadn't noticed it maybe until today. Yeah, so I'd say maybe about 6 hours ago, maybe a bit less.
Right. So you think it's just today that you noticed it, and it could be might a few days back?
Yeah,
the rash appeared, could be you didn't notice it, right?
Yeah, that's right. I didn't really check.
Okay, and where did it started? When you noticed it? So, on the back, on the face, which area is it more concentrated, or is it more apparent?
I would say it's more concentrated on the chest and back at the moment. Yeah, although I think it might have started a bit more in the face. There were a few signs in the face, I think, but it was very minor. I didn't really see much of it, to be honest. It kind of progressed very quickly. Yeah.
And any rash inside the mouth, or it's just on the skin area?
I don't think so. No, nothing in the mouth.
And what kind of rash is it? Is it a vesicular rash, or is it a flat rash, or is it a raised one? Any particular idea you have? What kind of a rash is it? Is it a vesicular one, or is it a flat one? Do you notice anything?
Sorry, what's a vesicular rash? What does that mean?
Is it a fluid filled? I mean, does it contain any fluids?
Yeah, I would say it's like a blister. Yeah,
it's like a blister, right?
Like small blisters.
If you pop it, if you pop it, the fluid will come out, right?
Yeah.
Okay. And it's only today, right? So is it painful and itchy?
He's not really complaining of pain, but definitely he's itching. He's scratching a lot as well. Yeah, it's itchy but not painful.
Okay, and this is the first time the rash appeared. No previous history of rash.
No, he's never had rashes before. No.
And any other symptoms such as fever?
Yeah, he has actually been. He's been a bit unwell the last few days. I'd say maybe the last 4 days he's been a bit unwell. Yeah, he's been sneezing and had a bit of a runny nose. Yeah, yeah, I'd say like a bit of a mild flu.
And did you measure the temperature?
Yeah, so the temperature was at the time was 37.7.
The mild one, right? Not
yeah.
A high grade fever. And anything else you're concerned about?
Not really. I just I just thought it'd be worth getting checked out, really.
Yeah, it's good to have an opinion. And anything, any previous history of such any medical condition the child might have?
No, he's been absolutely fine. Yeah.
And is he allergic to anything? Any soap or any clothes or anything like that? Any grass?
No allergies. No.
And did you give anything for the fever and the rash at home?
Yeah, I gave him a bit of Calpol for the fever a few days ago. Yeah.
Yeah. And if you know anything, like he visited any new place or any new area, anything like that?
No, just kind of the same routine as usual, really. Just going to nursery, really, and playing with his brother at home. Yeah.
And how was the birth of this child? Was it normal delivery?
Yeah, it was a cesarean, but otherwise it was normal. It was just my own choice. It wasn't for medical reasons.
And okay, and immunization, is he up to date? Did you
He's
give
up
him
to date, yeah.
Okay, and are you happy with the red book?
Yes, I am. Yeah.
And how is he developing well, or he's lacking behind any child? Do you think anything?
Yeah, no, I'm happy with his development. Yeah, I mean, he's probably a bit faster than a bit quicker than his brother. Yeah.
Okay, and he's playful. There's no any just dehydration or anything like that. He's crying with the tears and
Yeah, I mean, yeah, he's his usual self. I think he was a bit unwell, but he's actually since the rash, he's probably got a bit better, to be honest. Apart from he doesn't look well because he's got a rash, but yeah, I would say
And he's on mostly with you at home and with your husband.
Yeah, so I'm a housewife, so I stay at home, and so he's mostly with me. Dad works full time.
And any other child around him who had such rash?
No, there hasn't been. No.
Anyone in the nursery or any in the neighborhood?
No one in the nursery. Although he has been going to the nursery. Yeah. So I don't know if it's contagious or anything. If they'll catch it from him. Do you know what it is?
So according to the information and the rash appearance, I think I would like to examine your child first to have a better idea.
Right.
Is that
Okay.
fine?
Yeah, that's fine. Yeah.
Mhm. So I think my observation and examination finding shows that the rash is a vesicular, which means a fluid-filled blisters, which could be the condition known as a chicken pox. Have you ever heard about it?
Oh yeah, chicken pox. I mean, I did suspect it might be chicken pox. But yeah, just thought I would just check.
Yeah. So I mean, it's a common condition that children might get. It's a viral condition. There's I mean, it gets better on its own. So there are a few precautionary measures I would like to tell you to have so that the child can get better without any complications. So I think you understand that.
Yeah, I think that makes sense. Yeah.
Yeah. So for the symptomatic, as your child is having fever, I would suggest that you can give him paracetamol so that he doesn't get any high grade fever. And
Right.
if he's having any pain, paracetamol can work for that as well.
Right.
Are you getting that? So other than that, the rash is sometimes itchy.
It
I would
is. Yeah.
suggest, so I would suggest to cut the nails of the child so that he's not itching a lot, and it will
Right. Okay.
not cause any infection, and he's not scratching. And
Right.
I'll give him adequate amount of fluid so that your child is not dehydrated. And along with that, you have to keep the skin dry, so
Right.
to prevent infection to the area. Okay, are you getting that?
Yeah, I didn't think about cutting his nails. Yeah, because there's been a bit of bleeding actually from his scratching
So
quite
it's
a lot
better
on the
to
itch.
cut the
Yeah.
nails. So and I would suggest that a child might not get near any pregnant woman, as it's a contagious disorder that, and pregnant women are at risk of getting the infection, and then that could harm the child, the baby of the woman. I would suggest that your child must be in isolation until the rash is crusted to avoid contamination to the other children and as well as to any pregnant lady. I hope you understand that.
So yeah, I mean, what do you mean in isolation?
I would
Isolation
suggest that
from me as well?
if you're not pregnant, I don't think so that you'd be at risk of getting the. If you ever had an episode before, I don't think so. I mean, it's
I did. Yeah.
once a person get the episode of chickenpox, they get immune. So it's highly unlikely that you can get. But if you're pregnant, then you
I'm
should
not. No.
avoid then you should avoid using your child. And it's nothing like I mean, it doesn't mean that you have to just strain your child into a room. He can play, but it should close contact with any other children and any pregnant lady.
Right. So keep him away from his brother.
Yeah, keep him away from his brother. Yeah,
Okay.
and he can have a normal diet, but just a couple of fluids and fruits to build up immunity, and the vesicles will heal on its own in 2 days. In 5 days, they are crusted. So then after that, he'll not be infectious anymore.
Okay. So doctor, you mentioned giving him some paracetamol for the fever and the pain. So does he need anything to help actually treat the rash? You're not going to give him anything for that?
Well, the rash settles on its own. It's basically symptomatic. We'll give him something for itching if your child is having severe itching. I'll prescribe some medications to help stop the itching and fever, but there is nothing, no specific medication which will heal the rash. I mean, it's a viral condition and it's going to heal on its own within few days. It will be crusted and the rash will be gone on its own.
Any creams at all?
And there are no specific creams to prescribe.
Oh, okay. Yeah. Okay. One last question, doctor. So can you go back to nursery now?
Well, since the rash has appeared, I don't think so.
Well, you did say isolation, so I suspected he wouldn't be. But when would be a good time for him to go back to nursery then?
After the rash is crusted, it can take at least 5 days. After 5 days, he can be back to the nursery and he'll leave isolation. The main
5
thing
days
is
from now.
Yeah, 5 days from now. Since the rash appeared.
Right. Okay.
Yeah.
Right. So 5 days from now until the rash is clustered over.
Exactly.
Is that right?
Yeah.
Okay.
Yeah. I hope you understand that and addresses your concern.
Yes, it does. Yes. Thank you very much, doctor.
Yeah, thank you for visiting us. And if there is anything such as high grade fever and skin redness and neck pain, you can bring your child anytime to the emergency.
Right. Okay. Yeah, we'll do. Thank you very much.
Thank you very much for visiting us.
Okay. So how was that, Dr. Hira?
It was good. I think so.
Yeah.
It was good.
Yeah. I mean,
I didn't notice the time. Yeah, I didn't notice. I spent a lot of time in the history asking some irrelevant steps. So I should be focused more on management and I shouldn't be concerned about the time. management is really.
Yeah, I think with the timer, right? I mean, it's not a disaster if it starts turning green and you're still doing the history, but I think you should give yourself another. So when does it start turning green? About 4.5 minutes.
It's 4.5 minutes. I mean, it's a good time. It's pretty much time for the history, 4.5 minutes, and everyone should complete the history.
Yeah, I'd say the latest. At the very latest, if you've really overrun on the history, is 5.5 minutes. You know what I mean? So you can get your mark.
5 minutes, maximum. 2 minutes or 2.5 minutes should be kept for the management. I mean, it takes time for the concerns of the patient and the questions, so it's better to be quick with the history.
Yeah, and to be on the safe side, I'd aim to finish it, 30 seconds before time. And that will also, give you some time to address any concerns or expectations or anything at the end, just to double check that you've addressed them. Yeah, it is very difficult, which means that, it has to be superficial. And yeah, just have to constantly remind yourself and to keep acting with the timer. Because when I'm going through cases, like I'm practicing them, and it always takes about 10 minutes. Ideally I'd want like 10 minutes, which is how long they get in the GP exams, right?
Yeah,
so I think it is a bit ridiculous. 10 minutes is ideal, but 8 minutes is a bit ridiculous, to be honest. I don't know why they did that. So yeah, we just got to work around that really, and I suppose the only way to do that is to sacrifice on the details.
Exactly.
But not to sacrifice on the patient's concerns and expectations. They're the really, really important ones. Yeah.
We can sacrifice with the history, but management, and I mean, if we get marks in the history and lose the marks in management, we're ultimately going to fail it. So it's better to just grab some marks in the history and then management as well.
Yeah, I would think with every case, it's always good to think, okay, what's the key issues here? Are they related to the data gathering, or is it related to the management? And so when you first see the task, and then from there, you plan, okay, I'm going to orientate my consultation more towards, the data gathering for this one, because I think the red flags are really important. For example, in this case, they're a key theme in this case. They're not in this one, but, but so I think with this one, because you've been given images, she's emailed you some photos, and so it's pretty straightforward. The age group, he's 3 years old, which is bang in the middle of what you would expect somebody to present with chickenpox with. So it's all pointing towards chickenpox. So unless she says something in the history that surprises you, this is almost certainly going to be chickenpox. So you can sacrifice a bit of time with the data gathering. I think maybe just ask a few red flag questions. Check for signs of bacterial infection, any reddening or pain surrounding the rash, but then or discharge or anything. But otherwise, I think it's fairly straightforward. I'd say focus on the contact issue. So find out about the nursery and what nursery he goes to, maybe, and things like that. But yeah, otherwise, very straightforward case to start off with. So apart from the time, how did you feel that went? Happy with the content and everything?
I think it went a bit good. It was good. Like I told you about the medication and management pretty well. And history was good as well. I think it could be improved, but it was good.
Yeah. Okay. Right. So let's go through the notes. Right. So again, I understand that. Can you tell me, that child's been unwell, not been feeling well, and that you've sent us some photographs. So I've got those. Thank you very much for those. Can you tell me a bit about what's happened so far? And, nice open question to introduce, and then the rash. So we want to know whereabouts it's located. How big is it? What does it look like? Now, you mentioned vesicular. You can't expect a patient to know what vesicular means. I did ask you, what I asked you to repeat, what do you mean? And then you repeated the same term again, like you're using jargon, vesicular. So you should have picked up on that I didn't know what vesicular was. And so you should, adjust the way you're speaking so that you don't include any jargon. Yeah. You were aware at the time when you were saying that, right? When you were saying vesicular, you are aware that is jargon. The patient's not going to know what vesicular means. You're not.
I mean, vesicular is a simple English word, no? Or is it a medical term?
It's a medical term.
Okay.
Yeah. The patient knows what a blister is. They don't know what vesicle is. Yeah, they don't know what vesicle is, but they will know blister. So it's like a small blister for them. That's basically what I would describe it as to the patient. Yeah, this is why we talk about using resources like Patient.Info, is to get familiar with talking to patients, without using jargon, and using the nhs.co.uk website. Yeah, make sure you just keep reading articles on there just to make sure, when it comes to explaining conditions, that you're using language that the patient resonates with. Because I have found that, especially I've practiced in different countries, and I've found that doctors do are not really aware of what is considered medical jargon and what is. They just assume that, you know, a patient knows what an orifice is. They don't know what an orifice is. That's a medical term. So yeah, so we've got to keep things very, very simple. So yeah, double check what is it that's jargon and what is it that's, you know, the everyday use of English, because I find a lot of people do think that some medical terms are everyday terms when they're not. Yeah, yeah, itching and painful. Anyone else in the household? Contact. Yeah. So systemic review, I wouldn't have questions related to, you know, chickenpox, because you've already seen the image, so you're highly suspecting chickenpox, and you know, maybe some differentiating questions related to measles and rubella and maybe allergy. I think that pretty much covers you. I wouldn't go into too much detail going through a systems review. Yeah, I suppose with measles, you're pretty much covered. If you ask about vaccinations, it's very unlikely they've been vaccinated and they'll get measles. So that's a good way to, you know, if you do your BIDN, that will cover you for measles. Allergies you asked about. Did you ask about the tongue?
No.
The scarlet fever, but you know, yeah, I don't think, you know, that's not going to be what's going to pass or fail you in the exam. You know, I think that's a big problem.
I mean, the rash is on the body, so most probably it's
yeah, I mean, scarlet fever will also have a rash, but in addition to that, but you did ask me about the mouth. If you noticed anything in the mouth, you know, rashes in the mouth, so that kind of covers you for that anyway. So you did, yeah. And that also will kind of cover you for measles because of Koplik spots. Yeah. Okay. Not really any red flags for this one, really. Just maybe secondary bacterial infection. Yeah. And just overall condition, you know, dehydration, stuff like that. Just make sure he's not deteriorating. Make sure he's still alert, which you established that he's alert. You know, he's not unwell.
He's not, yeah.
Apart from mild flu-like symptoms preceding the rash. Right. So I was asking about nursery, when he can go back to nursery.
Yeah.
Yeah, you answered that well. So the infectious period for chickenpox, that's about 1 or 2 days before the rash starts, and then 5 days after, so until it's been crusted over fully, which usually is about 5 days, a minimum of 5 days after the onset of the rash. Yeah. So that's the kind of guide when you're advising mothers about, you know, contact with other children and going to nursery or back to school and things like that. Yeah. Did you say that you're going to take his temperature?
I asked about it. Did you measure it?
Yeah. Right. Yeah, she said a few days ago, you know, when he was a bit ill, she took his temperature. It might be worth when you do an examination, she's saying that you can do some observations. I would only really talk about temperature. I think any of these are really that relevant. I wouldn't necessarily say them in 8 minutes.
No, it's not possible.
Yeah, no point wasting time listing all the different basic observations. Yeah, I like to just I'll say basic observations, and then I'll say including, and then the ones that I feel are most relevant in this particular case. So in this one, the only one is really temperature. Yeah, I think with the explanation with chickenpox, the important things to mention are, number one, very, very common. Number two, doesn't worry you at all. Yeah, very basic. Remember, this exam is so superficial, so we don't need to explain in detail about the management of chickenpox. It's just very simple. Doesn't worry you at all. Resolves on its own in the vast majority of cases. Doesn't need any treatments.
I'm saying that we just have to reassure them and then explain about the diet and fluids. Yeah,
reassurance. Yeah, doesn't worry you at all. So reassurance, definitely. That's one of the key themes in this one. If you start worrying the patient over just chickenpox, then you're going to fail the station. If you start trying to worry them about it as if it's a big deal, so that's obviously like the major theme here. It's like when you did the febrile convulsion one. The major theme in that case is to reassure. This is similar kind of case.
Yeah. Well, just the symptomatic with paracetamol and all, and cut the needles. That's written in nice guidelines to cut the needles.
Yeah. Yeah. So you check the CKS as well. That's good. Yeah. Always worth checking CKS because you get a lot of academies. They don't do that. They'll give you, these notes.
CKS is very simple. Yeah, CKS is very simple. I mean, there is just patient language there. There's no heavy medical terms to, and it's not like a medical a book like that we have to memorize. It's kind of patient related.
Yeah, and I think a lot of people have struggle with, you know, especially, you know, coming from different countries, not understanding how the whole referral system works, and because you will get a lot of GP cases in the exams because they are expecting most doctors have become GPs anyway in the UK, and so that will be reflected in the exam. In the stations, you'll get a lot of GP stations, and so and the nice CKS guidelines are directly geared towards to advising GPs. So yeah, that's reading the CKS will also give you an insight into how that referral systems works and how interaction between the GPs, the hospitals, the A&E department, all the different kind of services offered in the community, like especially with the psychiatry stuff and social workers, occupational therapists. So all those kind of things, like reading the CKS guidelines will give you a lot more insight into that, and there's not really any other way of finding out. I mean, you can be spoon-fed that information by academies telling you, but often that information isn't really in line with the latest guidelines because they do change. So yeah, definitely it's best just to do it yourself and just read up the CKS guidelines and read up the British Resuscitation Council guidelines, and that will cover you for most things.